Hey everyone, Luke here with the Knee Replacement Therapist. In this episode of the Need to Know Show, we're going to discuss the question of when can I return to full activity after knee replacement surgery. Before I jump into that, be sure to hit that subscribe button, turn on the notifications so you can catch all of our latest videos. So this is a common question I get from almost anyone who goes through knee replacement surgery is, when can I return to unrestricted full activity? And really this is going to depend on a lot of different things, and there's a lot of different variables, and everyone's going to be a little bit different. But let's give you just some general guidelines. So first, it's going to depend on your surgeon and what the surgeon's recommendation and advice is. It's going to depend on your activity level. So if you're someone who just wants to do some light activity, some walking or something like that, it's going to be a lot different than someone who wants to do a little bit more intensive activity like weight training or jogging or playing tennis or whatever that may be. So there's differences in the activities that you want to return to. And also there's a lot of differences in your physical status. Are you relatively in shape? Do you have a healthy weight? How active, how in shape, how healthy were you before surgery? All these things play a role. But let's give some general guidelines. So for someone who wants to get back to just, some light activities, walking, doing chores around the house, doing dishes, doing meal preparation, doing the laundry, or maybe doing some light housework or things like that, really you can get back to this pretty soon. Actually, most instances as soon as you feel comfortable. Kind of the rough estimate is maybe approximately 6 weeks, give or take a week or two, either less or more, depending on how you're doing. But around 4 to 6 weeks, you can really get back to most of the light activities that you would want to do. When we talk about maybe some of the more moderate intensity type things, so maybe like hiking, or moderate like intensity weight training or going to the gym, maybe if your work has a little bit of intensity to it, golfing, things like that, that might take a little bit longer. So maybe we'll look at 10, maybe 12 weeks out. Again, everyone's going to be a little different, but roughly speaking, add a few weeks onto that if it's a little bit more intensive, the activities you're going. So 6 weeks maybe for light activities, maybe a few more weeks, 9, 10, 12 weeks for more moderate intensity activities and leisure and work activities. And then if you're someone who wants to get into some more intensive things, so for jogging or maybe doing heavier weight training, playing tennis, skiing, or maybe your job is a little more intensive. It has a lot of kneeling or climbing, stooping, squatting down, things like that. That's going to take a little bit longer. So there might be a small percentage of folks who can get back to those things at like the three-month mark. But for most folks, it's going to take at least 6 months probably to really get where you feel back fully to the activity that you want to do. Some people it may take even more, maybe closer to a year or maybe even a little more to really feel that you're comfortable and back to full activity. Now, a couple things to keep in mind is that, start light. Start with a lowest intensity that you can, start with the lowest volume that you can, and just work your way up slowly, progressively increase over days and weeks to get back to the intensity that you want to. And this might mean taking extra breaks, this might mean taking days off, this might mean communicating with, if it's a work-related thing, communicating with your employer about what you can and cannot do, and having those rest breaks fixed into your day. And it's about listening to your body. So listening to if you have symptoms, pain, stiffness, increased swelling, anything like that. Listen to your body and adjust. Adjust the intensity of what you're doing or how much of what you're doing as much as you can to make it work for you. And just understand that, it takes some guess and check, that you're going to have to use some common sense. You're going to have to use some logic to kind of figure out what's the best fit for you as you continue to rehab and recover and build strength and mobility and range of motion and just general health and wellness, progressively returning back to full activity levels while doing those things at the same time. I hope this helps answer that question for you about when can you get back to full unrestricted activity. Be sure to leave your questions below. Be sure to leave your personal experiences to help share with other viewers. Hit that like button so we can spread this video out to other individuals who may benefit. And I thank you very much for watching.